Hello everyone. Today is 14th November and most of us celebrate it as Children's Day in India. But along with it, it's World Diabetic Day as well, celebrated globally as an awareness program where the medical staff and the medicos are supposed to spread awareness, or common people who know something about diabetes can spread the awareness about diabetes, its manifestations, and how can people prevent from it. Diabetes is a chronic disease which can be managed by simple medicines or regular insulin, but it can also get nasty if not controlled or monitored wisely. Hence, every doctor advises a diabetic patient to maintain a blood glucose level which should be regularly monitored by fasting blood glucose level. Along with it, HbA1c test is also advised to the diabetic patient after at least 3 months, and the goal of the management should be to have a HbA1c level less than 7%. If the HbA1c keeps on staying above 7%, complications like retinopathy, nephropathy, and neuropathy may persist after some years. But keeping it below 7% or 7%, you can prevent or you can avoid such complications. A good blood glucose control in a diabetic patient is described as not too low but not too high either, because both of them can cause life-threatening complications. Yes, I am talking about coma. Patient can get into stupor or coma condition in either of the cases, starting with hypoglycemia, which is drop in blood glucose level or blood sugar level, as common people say. It gets really critical whenever the blood glucose starts dropping below 60 and 54 is a critical level, after which there are high chances that patient can get into coma, and that's because our brain works on glucose only. But if there is drop in glucose level in blood, our brain will starve and eventually it will get into coma. After that, second complication is diabetic ketoacidosis. It occurs when there is high blood glucose level. So what happens is, it needs a trigger. Along with having a high blood glucose, if you encounter any stress condition, that can be accident, any surgery, or any severe form of infection. And I also need to mention here, it can be physical stress as well, like working out or lifting heavy weights or gymming or doing vigorous exercise. Since the insulin is low in diabetic mellitus patient, type 1 or type 2 both, our muscle tissues are not able to get the sugar present in blood. Hence, the muscle tissue starts starving for glucose, which puts our body into a stressful condition, leading to release of cortisol, catecholamines, glucagon, which releases more sugar from liver into our blood. Hence, the blood glucose level rises more than it was before, and simultaneously the muscle tissue which is starving, that starts to digest fat tissue, which leads to release of ketone bodies. Now, in the blood there is excess level of glucose along with excess level of ketones, leading to an acidotic condition. Now when the acid level in our blood rises or the pH level drops, it harms our blood-brain barrier system, which is a barrier between our body and our brain, which kind of protects the brain from external forces or influences such as infection or drugs and medicines. This acidity or this drop in pH in blood kind of it starts damaging the blood-brain barrier, leading into encephalopathy. Now, the third condition is hyperosmolar coma. It is a complication where there is excess level of blood glucose, same as diabetic ketoacidosis, but now the complication is occurring in the kidneys. As soon as the blood having high glucose level reaches into our kidneys, while excreting it, starts to absorb more water along with the sugar to filter it out. Along with sugar, sodium also leaks out, leading to drop in blood pressure, and our brain can't survive in low blood pressure, hence leading to hyperosmolar coma. The clinical signs of all of these complications can start with palpitation, sweating, raise in heartbeat, polyuria, and dry mouth. Kussmaul breathing, which is breathing heavily or increase in the respiratory rate, along with a fruity odor coming out of your mouth. That can be because of the ketones and because the acetone is having a fruity odor. The complication of coma starts with simpler complications at first, like confusion, blurriness, disoriented, and stupor, which is getting unconscious. But later, if coma came into place, it is very hard to cure the patient. So it's better to take preventions prior reaching to any complications. Always monitor your blood glucose, or regularly monitor your blood glucose or fasting blood glucose levels. Be compliant with your medications. Don't take more or don't skip your medications. While taking medications like insulin, don't fast for too long, and always try to keep your HbA1c level less than 7%. If you are not able to keep it below 7%, talk to your doctor, and if he is not able to manage that, talk to some other doctor. He can increase your insulin dose or change your medications. Thank you very much.